And welcome back. Summertime is, of course, tanning time for a lot of people. But before you head out today, consider some sage advice now from Dr. Jennifer Walden. Dr. Walden's a plastic surgeon in Westlake in the Austin area. Hi, welcome.
Hi.
Thanks for coming.
Thank you so much.
Let's talk about the sun, first of all, that ultimate tanning disc that we all seem to revere so much.
Right.
I mean, it's dangerous.
Right. Sun exposure is the main risk factor for skin cancers and is very preventable. So it's important to wear SPF over 30, protective clothing, and go in the shade when appropriate. Things we've all heard about but should practice.
Yeah, and that SPF reapplying, that kind of thing as well.
Right.
Can we dispel one thing? Is SPF 15 or 30 effective enough, or do you really need something higher?
It really should be labeled SPF with those with those letters, 30 or higher, to be effective for helping to prevent. Those don't completely prevent skin cancers. Sun avoidance is really the best measure.
Can't always do that.
Right.
Obviously, wearing hats and things like that helps.
Hats and sunglasses.
Protective clothing.
Right.
What about, people love to go inside. We hear a lot about tanning beds, and they're an alternative, and the tanning bed industry is fighting pretty hard to make sure they stay in business.
Right. Well, recent studies showed that tanning beds are actually more dangerous than the sun, have a 74% higher risk of melanoma than just regular sun exposure. So that's an extremely important public service message, is that tanning beds are not safe at all.
What about in some moderation? People talk about getting a tanning bed to maybe get a base tan before they head to Mexico or something?
Not a good idea.
No.
10 minutes in a tanning bed equals about 10 minutes of UV exposure in a Mediterranean sun, so it's a very intense light.
No kidding. And we're looking at some video now of the spray tanning. It's a popular option for people. What about that from a health perspective?
Well, we just can't win with tanning.
Right.
So recent studies have showed that the DHA, or the active ingredient in those spray tans, can actually cause some cell damage in certain cell lines in the laboratory. Now, that hasn't been shown in human subjects, but it is cause for concern, and we should always wear protective eye goggles, nose plugs, lip balm, and do not inhale or ingest those substances. And please don't get it done twice a week, because we just don't know the safety of that chemical DHA.
Still pretty early on, obviously, so you're talking about an inhalation danger, not, as we know, as a danger on the skin so far. So really taking precautions if you're going to go that route.
Right, exactly. And for the workers in those places that are doing 15 to 20 spray tans a day, young people, young kids getting spray tan for beauty pageants, pregnant women, those are all people that should be concerned with even getting one at all.
That's something. Well, Dr. Walden, is there any way to tan in a healthful way? We all want to have that glow, right?
I know. Yeah, I mean, basically, go with your glow is like the campaign we have now in the field, and basically, tinted moisturizers, mineral-based makeup, exfoliation, eat healthy, get good sleep, and just kind of accept that skin tone that we have naturally.
Yeah, the one that God gave us all,
Yeah.
right? Dr. Walden, thanks for coming in. You're a plastic surgeon in the Westlake area.
Yes.
Great advice, great little tidbits.
Okay, thank you.
Appreciate it. We'll be right back.